So let's talk about the health of our people. Ndu,
Yes.
the government, through the president directed the establishment of a task force in 2019 in response to concerns that had been raised about the state of the citizens when it came to mental health. This task force was then chaired by Dr. Frank Njenga. They worked on a report, they presented a report, and the report was handed over to the Cabinet Secretary in charge of health. And there were a number of recommendations, which we'll talk about. Parallel to that, there have been attempts by legislators to bring forth some legislation on mental health and managing our mental health. One such attempt was made by nominated Senator Sylvia Kasanga, went through the Senate. Went through the Senate. Then it went to the National Assembly, and in the National Assembly, it entered some room. I think it's been there for a while. We'll find out what happened when it got into that room. Okay. So what is it that makes us have this conversation again today? We've been looking at what has happened in the last couple of weeks and the concerns that are being raised.
Sure. If we're looking at 2021 specifically, only in the last 2 weeks of 2021, we've seen about 11 murders having taken place by members, and these unfortunate deaths have been caused by members of the same family. So people are taking the lives of people that they love. I think that it's clear that there's a problem, and it's been said that there's been a lot of tension and there's been a lot of pressure, but it's quite unfortunate that the answer that people have is to take life away. The frustration has reached such peaks that people have said the only way that we can get out of this is to take a life. And I mean, it's quite brutal in the ways in which this has been done, unfortunately. Some of the stories that we've read just in the first few weeks of this year, the stories started to pile up towards the end of last year. Even between, we saw heightened cases of levels of domestic violence, and this was not just the norm of male to female, but then we saw across board, from parents to children, from children to parents, from man to woman, from woman to man. It does tell a lot about what's going on, the pressures that have been felt as a result of the economic strain that has been brought about, yes, by COVID, or even those that were latent. And then these situations just brought them out all the more. But yes, we've seen that the way out has unfortunately been murder. And like we said, children are killing their parents. Children are killing older family members. Children are killing their siblings. Family members are deciding to take the lives. Mothers are taking the lives of their children because they're not able to fend for them anymore. Fathers are taking the lives of their children and then taking their own lives because they also cannot fend for them anymore. What is this telling? That there is a serious problem. And even before we saw the results of that pressure that was felt in the news reports that we've seen, it was clear on a national level that there's something wrong. That the pressures that are being felt is not something normal and it needs to be dealt with. Has there been attention in terms of the mental state of Kenyans? Not enough, definitely. We also had the conversation here where practitioners tell us that, in terms of the attention and the resources, and here not just about money, but resources and facilities to take care of the mental health of Kenyans have not been enough, are not enough, and something needs to be done about that. And I think this is where we saw that in July last year, there was then this attempt to say, okay, let's put this together, let's collate this and see what has happened. It would be nice to know what the results of that report actually said.
Right. So let's start off by welcoming our two guests on this particular conversation. Dr. Frank Njenga and Senator Sylvia Kasanga. Good morning.
Well, good morning.
And thank you very much for joining us, both of you. I want to start with you, Dr. Njenga. You chaired this task force that presented a report to the Ministry of Health. And the task force was mental health and well-being towards happiness and national prosperity. So already there's that recognition of happiness and national prosperity is tied to the well-being and the mental health of the citizens. Then you basically had a couple of months when you were sitting and you were going around the country. I don't know whether you went around the country or you basically just spoke to fellow professional colleagues and coming up with this report. You can just tell us, how did you go about putting together this report and what did you find?
Okay, what we found was that the burden of mental illness in our country is very, very, very big. It's a huge, huge burden, number one. Number two, that the citizens of Kenya are fully cognizant of the problems that are associated with mental illness in general. And thirdly, that the investments we have made as a country to address these humongous problems is completely inadequate, and that we need to invest more, not just in cash, but also in training. And fourthly, that one of the drivers of this problem is stigma and stigmatization, and the Kenyans instructed us to do something about the whole issue of stigma. How did we go about it? We didn't just sit around and talk to professionals. We traveled across the country. We've moved from Mombasa to Kakamega. We moved across to Meru, Nakuru, Kisumu. We talked to professionals, yes. We talked to police officers. We talked to teachers. We talked to Waheshimiwa, yes. Sylvia, yes. So really, we talked to the whole cross-section of society. And in those four things that I have said, there was virtual unanimity. So we believe that our report is reasonably representative of the views of the people of this country.
Thank you very much for being with us, Dr. Njenga. You said you spoke to everyone. Now, I want to ask this very simple question. When you look at the sort of malpractice that happens in the highest offices in this land and with people who have been charged with huge responsibilities from the national government to the county governments, in your assessment as a psychiatrist of great repute, what would you say ails these leaders?
Oh, come on. I think you're being completely unfair to me. I had no responsibility to specifically examine our political leaders. And secondly, as a mental health specialist, I am not allowed by my profession to make comment on any person, let alone leaders, that I have not personally examined. That said, I would make a general comment, which is the fact that 20% of all people in our country will at one point or another suffer from one form of mental illness or another. There is nothing special, either positively or negative, about our politicians. And as long as we accept that politicians are just normal Kenyans, normal human beings, the propensity for them to suffer one or other form of mental disorder, whether it's alcoholism, whether it's depression, schizophrenia, whatever it is exactly the same as you or myself. But allow me not to comment specifically on human beings I have not examined.
I actually, forgive me if I sounded like I wanted you to be specific about your findings. I actually wanted a general understanding of what it is that leads people to behave in a certain way. But I specifically chose this group because they're in the public eye. And whatever they do, say, utter, has a very direct impact on the rest of the country. This is really where I was coming from.
I thank you for the clarification.
Yes.
Dr. In your report, you found, I think, is it 1 in every 10 have suffered from one form or the other of mental illness. And also there were some statistics that you presented in your report that say, for those who actually present themselves to health facilities, there was another statistic that you found about, is it 1 in every 4 that also present themselves with some form of mental illness. Just take us through those statistics.
Okay, we'll start with the simple ones. If you go to any village in Kitui, in Machakos, in Maseno, in Nyanza, Kiambu, wherever you go, and you looked at the people who are in the streets or in the market or in a matatu or in a bus or in a classroom, what you will find is about 10% of just normal people in the streets. 10% of them will have a diagnosable mental illness of one form or another. So even the viewers and listeners who are here with us today, 10% of them will have one form or other of a mental condition. Does that mean they need to go to hospital? Does that mean they need to go to a psychiatrist? Absolutely not. It just means that using the normal instruments, don't laugh, that we use, that condition is diagnosable in 10%, even if they happen to be members of parliament or cajuras, whatever you call them. So the second statistic that you wanted me to address is if you go onto a queue at Kisii District Hospital and you observe 100 people in that queue waiting to see the doctor or the clinical officer in that place, up to 30% of those people waiting to see the doctor, and it doesn't matter whether it is Kisii, Meru, or wherever it is, 30% of them will have gone to see the doctor primarily because they have a psychiatric or mental health need. What does that mean? It means that a lot of people will have a lot of investigations and will take a lot of time and resources of the government trying to make diagnosis for conditions that really require a psychiatric expert, clinical officer, or psychologist. And the third statistic that we mentioned is if you go to Kenyatta National Hospital, Kiambu Hospital, Murang'a Hospital, or even Kitui General Hospital, and it's a medical ward, and you examine 100 patients in that ward, 40 to 50% of them will primarily be there because they have a mental health need of one sort or another. And the final one, I don't want to know whether we included this one, go to any cancer ward anywhere in this country, and out of 100 people who have chronic diseases like cancer, up to 60 of them will have a diagnosable mental health need of one sort or another. Go to a heart ward where people are being treated for heart attacks. The numbers are very similar, if not the same. Point we are making the point that just because you don't recognize them as mental health needs doesn't mean they don't exist. It means they exist, but you don't have the expertise to recognize them.
Sounds like a disaster.
No. There's a future, don't worry. I'll tell you about the future in a minute.
Okay, you wanted the government to take some action on this.
Yes. I don't speak for government, but I can speak about what has happened since we handed over the report to government on the 7th of July of 2020. A number of very, very significant developments have taken place. The first of which is the fact that now, today, as I speak to you, Mathare Hospital is a semi-autonomous government agency, what you might call a parastatal, and work on, number one, providing medicines to Mathare, number two, giving Mathare a facelift, number three, getting the whole place spruced up. That I can confirm to you. I don't know whether you can be invited to go and see for yourselves today, but that has started and is ongoing, including provision of medication. Number two, we have been shown as members of the board at Mathare land that has been given to us somewhere in around Nairobi. One of our recommendations at task force was that really Mathare was a monument of national shame, and that the only way to treat that monument was to pull it down and get rid of it and build Mathare in a different location. I can confirm to you today that process has started slowly, one might say, but really, if we don't do anything else, and the third thing, which I'm sure Sylvia will be talking about in a minute, our recommendation number 11 was that we must support the Senate initiative for the mental health bill in full. And it is my hope that during the next few weeks and months, the Senate bill will see the light of day. There are a number of other recommendations that we have that I remain persuaded that government is serious about keeping the promises that they made about the implementation of this task force report.
Okay, so excuse me. Then Senator Kasanga, I mean, this is established very well by Dr. Njenga this morning. So, Senator, coming from a point of the law, because I mean, I know that Dr. Njenga is trying to get us to relax a little bit, because maybe we are not at crisis point yet, or that we shouldn't be too worried. But it does seem worrisome enough that national government, coming from the office of the president, be concerned enough to say that something then must be put into law and practice about how this must be carried out. What are some of the initial concerns then from you and the team, Senator, when it comes to what must be done?
Yeah, thank you, and thank you again for having me. It's really quite an honor to be able to address this issue here. I love speaking about mental health because from where I sit, from the time I was pulled into it, in my opinion, it's a crisis. And actually, Dr. Njenga's report did say that it needs to be declared a national disaster, because that's the status as it is. And why it is a disaster, it's because it's an area where the government has not given focus. And I mean in terms of course, the legislative interventions, rolling out of the policies, funding. Funding is a critical issue. You know, now that we have made a lot of noise about it right from 2018, and I want to say part of the reason why the government has taken the steps it has taken is the amount of noise now we were able to bring at a national level. We have brought this conversation to parliament level, and I think out of that, it has pushed the government now to realize that it's time that they now do their part. Because, you know, incidentally, from the time I started the advocacy work and pushing for this legislation, I have found NGOs and small groups of people working very actively in the community, you know, to help alleviate the stigma that Dr. Njenga is talking about, you know, trying to help people come to terms with understanding what is mental health. And you see, many of us don't even understand what is this mental health we are talking about. And when it is broken down and you understand that it's a state of well-being in which an individual can cope with the normal stresses of life, work productivity, and being able to contribute fruitfully to your community, then you realize it's an issue that affects even you and me and those of us who walk around thinking that we are okay, and yet maybe we are not okay. And mental health spectrum starts from, you know, everyday things just like anxiety, going all through the full spectrum, as Dr. Njenga would tell you, to very, you know, acute cases of schizophrenia and bipolar. It has a whole spectrum of it that we need to understand ourselves as Kenyans so that we can begin to deal with it. So the fact that there's not been enough education, enough communication, enough understanding of what we are dealing with as mental health, I say then it's a national disaster. Because then a lot needs to be done. And in fact, in our advocacy work, we keep saying that the work needs to be done from a family level, from a community level. You know, every aspect of mental health must be dealt with from that personal point of view, where it is the family that is involved, your immediate people who you live with, as well as the people who live around you in the community. It has to be community-based approach. And that is why the legislation then becomes very critical. I think I texted Eric and I said to him that it's an amendment bill that Senate approved and pushed. And it's amending an act that is as old as 1989.
Senator, if I can just ask you that, because you've just said something I think is important. You talked about it being a community-based approach. But if we look at how it has been practiced over time, anybody in the community who presented with any kind of a mental challenge was ostracized. So in terms of the acceptance of this being a problem, I think it's still very far from how these issues need or must be dealt with before it even gets to the national level, whereby anybody in your family who had any kind of instability was locked up somewhere or was deemed to be, you know, unwelcomed. So then how, through this legislation, are we going to make it something that will be accepted as all right to discuss and deal with? Because I think that's one of the fundamental things that you must deal with. Even if you have national legislation in place saying that the resources will be provided, how do you get people to take their loved ones? How do you get people to accept that their loved ones might have an issue before even presenting them to facilities and resources, even if we had the best in the world?
Yeah, Nduko, the beauty of our new constitution is that health is a devolved function. So the bill that Senate approved, the Mental Health Amendment Bill, actually seeks to devolve this function down to the counties, where the rubber must meet the road. It is for the county governments, to put in their structures for mental health, to ensure that we have functions that go down right to the village level. Are you getting me?
Yes.
Okay. So the idea is that at the county level, at the sub-county level, at the village level, you have some form of intervention. And that is where now your community-based health workers to do with mental health begin their work from. Their work of educating and identifying and helping families, reintegrating those who are from hospital, who are from rehabilitation, helping families understand these things. There's also an aspect of education, early childhood education, which is also a function of the county government, that mental health must be incorporated in the education as well. In fact, one of the conversations we've had with the director of mental health here in Nairobi is when they are rolling out what they call their quality rights toolkit program. And I have said to them repeatedly, we need our teachers to be equipped with, some basics of mental health, where they can identify and intervene when it comes to children. Because increasingly it's becoming clear that when we intervene at an early stage, you help people such that their mental issues don't become very critical as they grow older. So an aspect of teachers being roped in, and they can become like almost what you can call frontline, because they're the first, interactors with our children. All that is encompassed at the county level. And it is for the county governments now to ensure that under their health budgets, they have a critical budget for mental health, and they have rolled out their policies for intervention. And at national level, where we'll have the national, board of mental health sitting, it's now for them, their duty to come up with the policies that then they can roll out through the county government. So when we have a structure that is that way, then you can see it is beginning to work. You can actually begin to see if every county was active with a troop of mental health practitioners down there at the county level, and with hopefully a referral system that can work. Because the other thing that the bill is pushing for is an integration of mental health into the healthcare system. So rather than have standalone mental health institutions everywhere, what you have is that every, dispensary, level 1 hospital, level 2 hospital, like Dr. Njenga is saying, as you walk in to treat whatever, you're treating whatever ailments that you have, that even the doctors can identify that maybe you need a psychologist or you need some other form of mental health intervention, that it is there in that hospital. And in that sense also, something like NHIF is also covering the interventions for mental health. So we integrate mental health intervention into the healthcare system, have a referral system that works, and that would also help us to fill the gaps that are there, the infrastructure gaps that are there, including the staffing, the practitioners, for instance. We have very few, Dr. Njenga will confirm to you that we have very few psychiatrists in the country. So we have to allow other practitioners also to begin to, to help with intervention such that by the time a critical case is reaching the few psychiatrists, there has been some intervention along the way. So if you see that structure, the way I have described it, then you can begin to see it is possible to fight stigma. It is possible to start educating people about mental health so that they can understand, and then we stop locking up our loved ones in the home.
Senator, let me ask this question. What you've said actually is very, very comprehensive, and it's clear that this is something that is dear to your heart. Does it require legislation? Yes,
it requires legislation because somehow you need to hold people accountable. And one of the best ways to hold people accountable is there's a law that they're supposed to follow and utilize. And again, speaking from best practices, a lot of countries, again, we like to borrow from best practices. So even when we were working on this legislation with our stakeholders, we had to look out for the best practices around the world on how they are, they're approaching mental health intervention. So legislation is important for accountability. You have to hold the governments, both at national and county governments, to account when it comes to some of these things.
Senator, allow me to ask. There are many issues in the health sector. Mental health is one of them. The Parliament has the issue on assisted reproductive technology. We have issues of organ transplant, for example. We have many issues. Don't we risk don't we risk addressing health issues in silos as opposed to looking at it holistically, so that for once and for all, something concrete, something long can be done? Because when we do them piecemeal and tackle a few things, then we'll have the conversation you're talking about, where at some point we'll be talking about mainstreaming these things into the health system.
Well, legislation is evolving, and you see, it's when we approach it as and when. What are the most emerging issues? What are emerging issues at that point in time? Do they require legislation? You say yes. But as a country, becomes more mature, as you grow up and more other things evolve, then it's possible to look back and say, okay, maybe we need to collapse these bills into one and reorganize and do this and do this. But for the time being, we have to deal with issues as they emerge. I believe that it's the way to do it, it's the way to go. It's the way other jurisdictions have done it. And you can have as many laws in one area of expertise as need be. And then as issues evolve and as people become more mature, societies become more advanced, then maybe you can look back and say, this is outdated, let us repeal this, let's bring this together, because that also happens. In fact, as we were transitioning from the last constitution to the new one, there was a lot of repealing and a lot of merging that happened. So I believe there are times when these processes can happen, when you can look back and consolidate. But for now, we have to deal with issues as they emerge. And for me, mental health is a crisis, and it must be looked at first individually, even before you want to merge it with everything else. You must address it individually, sort it out, and then maybe in the future we can look back and say, all right, we can merge this and this and that.
You're in the room with C.T. Muga, Ndu Oko, Eric Latif, and Dr. Mercy Korir. Joining us in this conversation is Dr. Frank Njenga and Senator Sylvia Kasanga, talking about mental health. The report that was presented by this task force chaired by Dr. Frank Njenga had so many, statistics that make you actually feel, wait a minute. If we were as serious as Dr. Njenga, you're saying that, you're expressing optimism here and some positivity that, the government is doing something about it. But seriously, when you say that 10% of our population have one form or the other of mental illness, if you say that you go to any hospital right now, out of every 10 people in a queue, 3 of them would have some mental illness issue. And they may be going there, they don't know this is what they're suffering from. Then they meet a healthcare worker who may not be well prepared or knowledgeable to diagnose properly. We actually are having an issue. Your report recommended to the government that they should declare this a national emergency. They should treat it as a national emergency. Do you honestly feel that since July last year, Dr. Njenga, to now where we are, the government has actually treated this mental health status of its citizens as a national emergency?
It would be pretentious of me to answer in the affirmative. The answer to which I could answer in the affirmative is this. Is there evidence that the government in all its arms has the intention to pay attention to the recommendations that were made by the task force? The answer, I have to say, will be in the affirmative. As to whether they will change their mind and go back and slip again, I cannot speak for government on that one. But, I am unable to, with a clear conscience, say that our report was submitted and it is now gathering dust. I don't think that is the truth. I have seen evidence, very clear evidence, that some action is taking place in the right direction. You see, I'm a mental health specialist, and I really are in the business of looking for silver linings around very dark clouds. As Sylvia Kasanga said, I am not in the least suggesting that we don't have a big problem. Our report on second recommendation is very clear. We have a national emergency. And in fact, one of the recommendations there is that we should do what we did in 1997 when HIV/AIDS was killing our people. Former President Moi, now lost, put in place an emergency response effort that over a period of 10 or 15 years, reduce the prevalence rate of HIV infection in our country from a high of about 15% to the present of 4 or 5%. Now, that took the commitment of not just government, but also the populace of our republic, including parliament. So what we have done as a task force is to put the spotlight on with all those numbers that we have given you. And we as a task force have said to you know what? You people in the media, you people in parliament, you people in the executive, unless you do what the government did in 97, this thing is going to finish us. And what I am saying is that I have seen some evidence that some people, including the fact that we are here this morning, there is some evidence that the society is taking note, and that for me is encouraging.
Dr. Njenga, I would like to ask you to please give us further examples of the changes or the positive moves that you have seen, so that even those who are listening to us can actually listen and hear, because there could be changes, they're happening before your very eyes, but you're not even clear what it is that's happening.
Okay, now I have told you the example, the best and living example, the example that led to catastrophic observations on our part was the Mathare Hospital, which, as I said, was declared a monument of shame for us. That, for me, the things that are going on, the Gazette notice of August last year that declared the hospital to be semi-autonomous, the fact that it is now a parastatal, that for me is a concrete example of something that is happening. Number two, and again I've mentioned this, the task force, members of the task force have been taken by government to a site that is there and it's feasible, and government has allocated 200 acres of land to Mathare Hospital for the development of a new teaching referral hospital that will be a center of excellence, not just for Kenya and the region. So if those are two concrete things in our report that have found, for me, the light of day, and that is visible.
Thank you very much. Now, where exactly is this new site? Where is this new site, and when do you think? Again, forgive me for assuming duties that actually the government's, but since you have been taken there, when does the government suppose that they might actually begin the actual process of constructing this unit?
No. Things don't go like it's a huge site. I think where the land has been identified. The task force members who were there were taken there physically by the cabinet secretary, by the people of the Ministry of Lands. The process of issuing title right now, as we speak, is ongoing. The big ships take long to turn. I think this one will take some time to turn, but I can tell you, with my own eyes, I have seen this land, and it's up actually in Ngong Hills, near the new tunnel that links the SGR from Nairobi to Suswa, but on this side of the city of Nairobi. But it's there, and it's real, and it's in Ngong.
Dr. Okay, there is the role of the government, but government cannot do some of these things alone. A big player there is the community, then the media. How do you see the roles of these two particular persons coming into, sorting out the issues or being able to address the issues of mental health?
Let's start with the media. You media now.
Okay.
The fact that you have invited Mheshimiwa Kasanga and myself this morning is evidence that now, whether you like it or not, matters mental health are on the table, and that if you have made the editorial decision that it is wise, right, and proper for your listeners to be exposed to a whole hour of a conversation on mental health. I can tell you, and I've been around for many years, this kind of editorial decision that you have made this morning, for me, it's new. It's not, it might appear because you're young that this has always been the case. It's not always been the case. People did not want to talk about mental health and well-being. But it's only in the last few years that editorial time is put in, and it's not just in spice. Other media houses have seen the value and utility. So I'm sorry, but I have to commend you, people of the media, because you have responded quite correctly and appropriately. And I would like to encourage you to continue along that line. Number two, society, the community. I can tell you it's not just small groups. I can tell you confidently that the teaching profession has embraced in a way that has not perhaps reached the media. Industry is calling mental health specialists all over to help them be educated. The discipline forces are doing the same. Our community, surprise, has received, okay, I sound like an optimist in everything I say, but that's just because of the way I am. But it's true. More and more organizations are calling on the Kenya Psychiatric Association and other mental health experts for lessons and training in the field of mental health. There is more than a silver lining in this otherwise very dark cloud.
Dr. Njenga, I think this is something for you and also for Senator Kasanga, sorry. But if we start off with you, Daktari, a lot of the mental health, pressure can be attributed to economic times that we saw because of COVID-19. From what you've been able to see, even before the advent of COVID until after, was that burden as strong pre-COVID as it is now? And can we say that COVID contributed significantly to this?
Yes. In May of 2020, 2 months after COVID arrived in this country, the World Health Organization, in its wisdom, pushed out a warning to the entire globe. I think it was the 15th of May. And the warning was very succinct, and it turned out to have been completely prophetic. It warned us that as the pandemic goes on to envelop the world, incidents of mental health needs, insomnia, depression, anxiety, alcoholism, and other drug users would shoot up because of the kind of stresses and pressures that you have mentioned that are attendant to the pandemic. Exactly what was predicted has happened. There are more and more people abusing alcohol and drugs. There are more and more people with depression and anxiety disorders, people losing. So the answer is yes. What COVID did, COVID found a fire of mental illnesses that was burning, but COVID ikalete mafuta ya taa na petroli kajumlisha. Now the fire, now you are laughing again, but that's what happened.
Senator.
Yeah. No, I agree with the doctor, definitely. Although I'm not as optimistic as he is, I guess because when I'm a legislator, and we have to be very critical of the government. And I have to say, since 2018, when I started, when I was roped into this advocacy work for mental health, not enough. Honestly, not enough is being done. And of course, COVID has made things worse, as the doctor has said. But the fact remains, we are still in a bad way even before, because the statistics that the doctor has mentioned in the report were pre-COVID statistics. So we're still in a bad way. We're still in a state of emergency even then. So a lot more needed to have been done by the government. In fact, from the time the president pronounced himself on it, when he pronounced himself on the issue of depression, you would have expected the cogs to turn a little faster when it comes to some form of intervention. Now, rightfully, the doctor also says we should approach mental health the way we approached, HIV back in the 80s and 90s. So if that is the case, from the time the president pronounced himself, Shouldn't we be seeing a lot more communication? Shouldn't we be seeing a lot more intervention? By now, shouldn't we be seeing an active approach towards mental health intervention, say from the Ministry of Education? Because it has multidimensional approach. It has a wide multidimensional approach. So you'd expect that by now, certain other groups have been seized. Now I know the uniformed force have been seized of this issue. It was included in our bill when our bill went to National Assembly. But now I know there's some active approach towards helping our men in uniform when it comes to mental health, because they are most affected because of post-traumatic stress disorder and anxieties like that. But without a doubt, COVID has definitely taken it to the next level. Of course, making it even now beyond an emergency situation. I have had, when I was chairing the ad hoc committee on COVID, of course, I had the question of, what interventions are happening from the national response team and other county response teams when it comes to helping people with mental illnesses, the access to medication, which had become a challenge when the skies had closed down. We had a worry that those who need constant medication may not get their medication. We even had to sit with KEMSA and other organizations, government organizations, to be sure that our mental health space is protected, but it was still a challenge. And then there's, of course, NHIS. Access to mental health care is still, it's still not there for most of our citizens.
But Senator, if I focus on what you as senators can do, what is it that you plan to do and you plan to put in place to ensure that these changes that are really definitely much needed actually happen?
If we had a legislation on which we can task the county government, like from Senate, because that is the oversight role of Senate, then we would be asking these questions. We would be sending out questions to the counties and asking them, what have you done? You're mandated to set up a mental health board. You're mandated to set out a budget of X amount of money. How are you using that budget? We would be asking those questions. We'd be asking, how many staff members now do you have?
Is something preventing you from asking those questions, Senator?
No, we do. Actually, we have asked those questions before.
And what responses have you received?
Not much. Not much. I'm sorry to say. In my advocacy work, again, this is what I do from a personal point of view. I have interacted with the county governments of Kisumu, Makueni, Machakos, and Nairobi when it comes to mental health. And I can tell you they are doing some active work when it comes to that. In fact, like Kisumu has a directorate of mental health. They have a lot of challenges there, but they also have a lot of NGOs working there and supporting the county government to set up their policy interventions. Makueni already has a good plan for mental health. They have even rolled out practitioners to the sub-county levels, and they're doing some impressive work when it comes to that, including, information, giving information to their citizens on issues to do with mental health. Nairobi as well, Machakos as well. So there are counties I can say that I've interacted with that are doing something. But you see, we need also more money to be devolved down to the counties. That it also boils down to an issue of resources. And of course, then the goodwill to go with that. So these questions, I can assure you, we have asked. But a lot more still needs to be done from a national level so that then we can get every cog turning on that matter.
And as we conclude, Daktari, I'd like you to pass on a message to those who are listening and those who are going to watch this broadcast later. There are many cases of people who maybe they don't even know, but they are suffering from some form of mental illness, one or the other. What would you like to tell the society? I mean, as we are going through the emotions of COVID-19, of the economy and everything else, what is it that you'd like to tell people? How can we identify the mental health cases? What can we do about that? How can we encourage one another?
There's a lot of questions, but I'll try and answer them all in one breath. The first thing is that this thing of mental disorders is here with us. It's here to stay, and it's real. And the only way to deal with any challenge that comes our way as human beings is to be able, number one, to recognize it for what it is, to understand and appreciate what its potential consequences might be if you don't do anything about it. But crucially, and this is something I have said many times before, I would like us all to understand two things. One, that mental health issues are not 2 or 3 matters. There are almost 300 different mental health conditions that exist in the diagnostic and statistical manuals that define the mental disorders. The ones that we see and you alluded to that lead sometimes people to act in aggressive or violent are actually, ironically, in the minority. The more common, the so-called common mental disorders, CMDs, are the kind of things that you and I might be harboring this morning, but did not stop us coming to work. Situation like people who didn't sleep properly at night, people were a bit irritable this morning, people are feeling a little bit sad and anxious and afraid. But the last thing I'd like to say in this very long question you've asked me is this. Mental illnesses are extremely easy to recognize, to diagnose, and when diagnosed and treated early, the outcome of mental illnesses is excellent. People get better. People go back to radio and television stations. People go back to the classrooms and teach. Mothers go and look after their little babies. Doctors go back to work. Police officers go back and keep us safe. Even politicians go and campaign when they get. So really, my overriding message is on the message of early diagnosis, early interventions, and excellent outcomes. And I say this from many, many, many years of treating these conditions.
Asante sana Daktari. Dr. Frank Njenga is a psychiatrist and mental health specialist, and Sylvia Kasanga is nominated senator. Thank you very much for joining us today, and we wish you a good day. Yes, your parting shot.
Please,
as
by
well.
all means.
Yes, yes.
Passing shot. Just to tell our listeners out there and our viewers that we need to be so self-aware. You know, self-awareness is critical. Listen to yourself, listen to your body when you wake up, and also to recognize that the social determinants that are there that cause mental illnesses are our everyday life. Traffic, for instance, in Nairobi, is enough to cause you enough anxiety that can make you get to a place of work when you have, you know, your heightened levels of anxiety that can cause a lot more distress. And lastly, let us keep this conversation alive. That is something I always tell the groups of people that I talk to. We must keep this conversation going. We must fight stigma by talking more and more about it. And I thank you, Spice FM, for having this 1 hour today. And I just encourage you a lot more. Get more people to talk about it and, you know, highlight more and give more light to this issue. Thank you so much.
Thank you.
Thank you.
Very well said. And in fact, thank you very much for reminding us that we needed to give you that opportunity to tell us that. Asante sana. Have a lovely day.
Thank you.
Bye-bye.
Thank you.
Bye-bye.
Thank you.
So good conversations that we've had this morning from covering several aspects of health, from the health of our healthcare to the health of our people, okay? And as we come to the end of this, to what is expected now to deal with COVID-19 in terms of giving ourselves vaccines and all, first on mental health, and I think that the questions that we kept asking Dr. Frank Njenga, and he was saying it without saying it, is the government is doing a little bit, but it's not doing as much as it should be doing, especially when it comes to matter of elevating a conversation such as this that then becomes a national emergency.
Actually, the government is doing what it does best. This is it.
Pussyfooting.
This is it. Because he gave the example of the issues of HIV and AIDS, and he was right about what the president did. But to add on to that, the reason why HIV succeeded as it did was the bulk of that work was funded.
Yeah, I was about to say that. The government talks, but it doesn't follow the talk with money.
It was funded. For the longest time, it was funded. Almost every aspect of HIV in this country was funded.
Externally funded.
Yes, externally funded, and they followed up with measures and standards that they wanted maintained.
Yeah.
And it was supervised and it was guaranteed. So it contributed significantly. Remember, we already had the people who could do this work. But because of that, it was done. Now, we will still have the people who can do this work that we're talking about with regards to mental health. But the government effort is one thing. And I'm saying this is it. This is the standard that the government tends to have.
Mental illness.